My name is Dr. Noé Romo. I am Director of the Pediatric Inpatient Service here at Jacobi. Normally, during normal times, my main job is to care for pediatric patients who are admitted to the hospital. But during this COVID pandemic, I was asked to care for adults who came in with COVID disease, and now I'm also caring for pediatric patients who come in with COVID-related disease. These last 2.5 months have been very, very humbling for all of us working here in the hospital, including for myself. We learned a lot about this virus, and we learned a lot about the devastation that it can cause. At the peak of this epidemic, we were losing 20 to 25 patients a day to COVID-19 here at Jacobi. 93% of the patients that we saw here at Jacobi were either Black or Hispanic. This virus disproportionately affected people of color and disproportionately took them away from us in ways that we've never seen before. The adult ER could easily be described as a sea of black and brown faces that were quite simply gasping for air. The most devastating part of this disease was the fact that people died alone. At the peak of this pandemic, people were not allowed to visit, family was not allowed to visit their dying family members because there was fear that they would also contract the disease. So family members were forced to die alone, and we try our best to keep family members abreast of what was going on. We tried to do FaceTime, but at the end of the day, people died alone. Typically during this time of spring and summer, we see a peak in gun violence. Typically during this time, there are more stab wounds and gunshot wounds that come in. The majority of those patients also happen to be predominantly Black and Hispanic and predominantly males. And this anguish that is caused in these families is just the same as it was during COVID. That same sea of black and brown faces that we saw during COVID is the same sea of black and brown faces that we see on any given day in the summertime here in our trauma bays, where we see a sea of Black and Hispanic young males who are shot and or stabbed. And we also have to deliver bad news to those families in the same way we did during COVID. This global pandemic of COVID disproportionately affected the Bronx. The Bronx had the most deaths per capita of any borough in New York City, the most cases per capita of any borough in New York City. Similarly, the Bronx happens to be the borough in New York City with the highest rates of homicides and the highest rates of violent trauma as well. So as you can see, both COVID and violence disproportionately affect our Black and Hispanic communities, and it is up to us as a community to fight both this summer. The SNUG campaign citywide and Stand Up to Violence here at Jacobi is working incessantly, even during the pandemic, to help fight violence and help mediate conflicts in your community to prevent that sea of black and brown faces from coming into our ER. But also, at the same time that we are fighting gun violence, we have to continue to fight this global pandemic. We have to continue to keep social distancing rules in effect. We have to continue to put masks on. We have to continue to protect not just ourselves, but our family, our friends, and our communities. Every time you put on a mask, every time you keep 6 feet away from people, you are telling that person around you, I care about you and I care about your health. It is critical. Please put on a mask, wash your hands, use hand sanitizer, stay 6 feet away from people, protect yourself and those around you, but also use this time of grief that we have all experienced to value life for what it is and what it stands, and to avoid any conflicts and violent trauma, so that this summer can be the first summer in many summers where violence is down and where deaths from violent trauma do not supersede those that we saw with COVID. Stay safe, healthy, and blessed.